Hello, OT friends, and welcome to the Uncommon OT series. I'm Patricia Modis, and I'm your host, a Filipino-American, native New Yorker, currently based in Los Angeles, bulldog mama, and an uncommon occupational therapist myself for the past 22 years. On this podcast, you will hear me proudly feature the unique careers of occupational therapy practitioners working in non-traditional and role-emerging practice areas, settings where OT is uncommon. I invite you to receive a dose of OT inspiration, to learn, to think outside of the box, and to be energized and motivated to follow in these unconventional paths. Happy listening! Before we begin this episode, I want to extend a special thanks to Picmonic, our sponsor. If you are an OT or OTA student looking for an excellent learning resource and study aid, Picmonic might be for you. Whether you're studying for your classes or getting ready for the NBCOT exam, it is a visual mnemonic learning tool that has been research proven to increase retention and help students ace their exams. It uses audio-visual learning and intelligence-based repetition algorithms to help with long-term retention while studying. If you're interested in trying it for yourself, sign up today using the link in the show notes or using the code TRANSITIONSOT to score a discount of 20% off your Picmonic membership. Today, I am thrilled and excited to introduce you to our guest of honor, Dr. S. Preethi Shanmugapriya. She is an occupational therapist based in Tamilnadu, India, working in acute mental health and specializing in working with women who have experienced trauma. That's her specialty. However, she also provides holistic mental health services, which I hope she'll expand upon a little bit more in this rural portion of India. So without further ado, welcome to the podcast.
Hi, everyone. So thank you, Transitions OT, for having me here. And I love to share my thoughts and experiences through this wonderful opportunity and the platform.
I'm excited to hear about your work. I know that your work is uncommon here in the United States, but I'm thinking that it's much more uncommon where you are. So part of this is to hopefully help inspire other occupational therapists who might have been in the same shoes that you were, kind of looking for support, looking just for, guidance, right? And hopefully this will help pave a path for some of them. So I'd love for you to tell us a little bit about yourself and maybe some of your favorite occupations just to get us started.
So I'm a person who always likes to be creative, and I find my solace and healing through arts and also through nature. So most often I will integrate art and nature thing in my work as well. So I have done some certifications or some trainings under that as well, like expressive arts therapy and nature-based outdoor practices. And I also believe in eco-friendly and sustainability things. And I also having a vision to slowly integrate that as well within my practice. So currently I am passionate in helping women to recover from their emotional trauma. So this shift in my professional life has happened from, though I'm a individual who is basically passionate in mental health, but the shift to provide that support specifically to women or specifically to this emotional trauma is because I have experienced clinical depression, and then I have been diagnosed with complex PTSD, and I am in my healing journey as well, and I'm taking support in my recovery as well. So parallelly, I'm also like to extend a hand to the ones who are in need of that support as well. And
I love that. Thank you for sharing.
yeah, most welcome. And apart from that, I have founded this organization of Inclusive Wellbeing. and it is located in Tenkasi in Tamil Nadu. We function both online and offline, but online is a primary means of work right now because in actually Tenkasi is a small town, and of course the mental health taboos and unawareness is still prevalent, and the number of people who come directly to the clinic to have the mental health support or services is, it's rare, or just now people are
Hmm.
starting coming out. So I primarily rely on this online service right now, and
Got it.
focusing slowly to develop offline and expand services offline. And in
Yes.
online, I have a team of mental health professionals to work alongside me. Of course, for them, it is a part-time. So this is mainly to provide an opportunity and scope for fellow autists who are interested in mental health, and they need to have an experience of working or providing service in acute mental health. So I felt glad to give them that opportunity by having them as a team. Also, referring them clients if I'm not able to take, or we will just switch back with the clients. And it is mainly because in India, the scope for OT primarily lies on pediatric setup, and even though now it is now the neuro working in neurological area is booming, many hospitals are recruiting OT, particularly for neuro rehab care.
Got it.
That's the thing. But when it is come to psychiatric, yeah, it is yet to expand. Or
Yes.
and few hospitals do have the role of OT, but it is still limited and confined in our in acute sorry in chronic patient rehabilitation. So
Yes.
considered as we are only for rehabilitation and not for a prevention or promotion of health or for habituation also. Yeah. So
Which are some of the services that you offer in
yeah. So
your
that's why I wanted
practice?
to provide that experience or opportunity to fellow OTs who like to have uh, who like to build their capacity in providing acute mental health care as well. Often our internship postings also involves in a psychiatric hospital setup.
Hmm.
And we have never been given an idea that we can also do this acute mental health care. Nobody
Yes.
has told us or introduced us. But in my journey, after reading a lot of OT history, principles, and what WF40 has said, and what uh, other Canada or AOTA is doing, after observing all these things, and I gained courage to do. Okay, fine, let me do it. Let me start it.
Yes. And in
Yeah.
fact, we're going back to our roots, right? Which are really in mental health. And I
Mm.
absolutely love that you gained the courage, whatever it took, to be able to do what you're doing because you're really providing accessible mental health care, mental health support.
Yeah.
And, this your ability to be able to do that through Zoom, which could be a more confidential way for folks to receive the services, right? Considering the stigma that there is in the communities, you're just making this available to
Yeah.
individuals who may not be able to walk into a typical office.
That's true.
So I applaud you for that.
And one
Congratulations.
thing, thank you so much. And one more thing is in India, yeah, it is a developing country. There is a scarcity of mental health professionals, actually speaking. After this pop culture of, a lot of mental health awareness through social media, and when it comes to youngsters, they are getting a lot of awareness right now, but when it comes to seeking therapy, there is unavailability, there is a scarcity in therapists, mental health professionals who are providing the services. So I
Yeah.
think government should consider including occupational therapists in the mental health care team, but it is not yet here. I think
Yes.
that long way to go towards advocacy and policy making when it comes to this
Yes.
area. Yeah.
And that probably explains why you've gone the entrepreneurial sort of
Yeah.
strategy, right? So we'll get to that in a moment because I want to hear more about like a typical day, some typical sessions that you might have. But before that, let's fill in the gap. So here you are now. You've embarked upon a private practice, providing a much needed service and making it accessible to a lot of individuals who may not have been able to, um, really just get that service, period, because of their locations, and because of social stigmas. Can you tell us how you got there, right? So you went to occupational therapy school. What kinds of experiences did you have? And then, what kind of led you to be able to gain the courage to embark
Definitely.
upon this journey?
So this is a story that I always love to share about, speak about the journey of how this happened here. And yeah, as a OT student, actually, me choosing the OT profession is itself my conscious choice, because in India, of course, it is not a much sought after profession. And in an aspect like every parent will aim, wish their children to become a doctor or an engineer, like medical doctor or an
Mm-hmm.
or an architecture, or
Yes.
preparing for some civil service examination and to get a posting from the government. Yeah. So when I thought of choosing this, OTs itself like gave me a kind of new spark, because um, as a even as a student, school student, I have got some interest, natural interest towards psychology. So actually I thought of choosing psychology, BA in psychology, uh, or something like naturopathy, uh, that area. And when I actually got to know about occupational therapy through internet, when I read about it, so it's really sparked within me. Oh, there's a combination of mental health and physical health, some rehabilitation that felt that gave me a sense of spark. So I stand very firm that I have to choose this. Like there has been a lot of you know. Uh, disagreement within the family. My father didn't accept my choice, and he was like, no, 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 you should take some other course. Even after joining, even me after joining the course, he was insisting change the course. All such things. And okay, but after my actually while I was choosing OT, I thought I will be in love with pediatric practice. When I was as a 12th graduate student, when I was seeing the pictures of helping and supporting special children or children with difficulties, that really makes uh, me move towards OT. So I thought that will be my special interest. But after going through my studies and postings, I realized my natural skill is more proficient when it comes to mental health. I mean, adult care. So when I've been posting in psychiatric setups, or when I have been posting in internships, when I noticed myself how my energy is naturally feeling light and naturally feeling that givingness, and I'm
Mm-hmm.
more uh, you know uh, enthusiastic to work with adult care uh,
Mm-hmm.
than with pediatrics. I mean, comparatively, I felt more you know uh, connection towards adult psychiatric care. And especially during my internship, when I was working in a hospital, I mean, I happened to give some group therapy to, bipolar population clients. So at that time, I just experimented and introduced this arts and, movement to, help them move and understand their parts or something like that. And through few sessions of that group therapy, few of two of those people in the group, and they expressed a lot of fulfillment, that they said she didn't thought that she could dance, because throughout her years she has been bullied for her body, like she had a body image issues, and she thought that because being fat means we shouldn't dance. Or
Mm.
that is how all others have said to her from the childhood.
Yeah.
Yeah. So, but she have danced during, maybe after third session or fourth session, she really embraced her own self. And that was the point that really clicked me. I have to integrate this expressive arts therapy in my practice. And it also, it's a clear cut direction for me. Like I need to only work in mental health. But again, when I look for the opportunities to work in mental health, there is none.
Yes.
So, out of no choice, I have went to work in an NGO first, which had a combination of stroke rehabilitation setup as well as an inclusive school within that NGO. So I worked in both areas, like morning day part is with the stroke rehabilitation, and post
Mm-hmm.
lunch it is with the special children. So that was my job. And that was the time after 3 or 4 months, I have noticed some symptoms within me that I have started experiencing depressive symptoms. And that is the same time that I was also about to do some courses related to expressive arts therapy and counseling, trauma informed counseling and all. And then this lockdown happened. And actually, I left the job in order to pursue the certifications or courses. And while I was actually doing that, parallelly, I was also experiencing the symptoms, but I was not aware. I couldn't tell myself that, yeah, I'm having depression. There is
Yes.
something in me. I was, okay, this is a phase. Maybe after this phase, I will be all right, all right. But after 2 months, I got a clear cut idea. Yeah, I am going through a real signs and symptoms of depression. I should seek help. Began to seek help from a psychiatrist and then a therapist, and I have worked with myself. And that recovery journey in the lockdown time, it was really intense. And
Wow.
yeah, so after that, I happened to work in natural outdoor setting in
Mm-hmm.
the kids to recover from their autism. Actually, they are autistic, and there's a mix of autistic or ADHD kids. So there is a special educator, and she is running a residential setup kind of work. And her belief and her vision is to provide her work is to provide the children, the therapy, not only just like a 1 hour therapy or what we do in a very traditional therapy setup, but she framed a kind of residential model care, which is primarily closer to nature-based practices. So there I have joined as an intern for 3 months. So at the same time, that was a time when I have actually healing my own depression and trauma. I mean, I was quite getting better, so I joined there. And there's an immense healing potential I understood and I felt myself, and I also witnessed the kids they are experiencing within themselves when we actually put them in closer contact with nature. And some practices, even the sensory practices or any lifestyle shifts, etc. So
Mm-hmm.
that's where I got strong ideas, insights towards nature-based therapy, as well as integrating, I mean, the holistic part of care, whether it is for kids or whether it is for adults in mental health. Because I myself experienced that, healing potential of being in that space itself, which is very closer to nature. There is a stream beside, there is a mountain behind. We'll just go for a nature walk. All such things I have had that experience for 3 months working alongside with the kids. Yeah, so I witnessed the power of nature and the power of art, and slowly again got a clear idea that I'm going to work in mental health. But maybe since I have gone through my own personal recovery journey, I was not confident enough to provide and support individuals in a mental health area at that point of time. So I thought maybe I need few more years to settle down to focus in this area. So until that, I can work in another area. So then I have worked in a dyslexic school for 1 year. And that was a really wonderful experience of working with kids again. But somehow, again, my passion towards work in mental health became strong. And I also slowly became confident in providing as an independent practitioner as well over the period of time, parallelly working on with my own healing, and slowly I gained that faith and confidence, and okay, I can provide, I can hold space for somebody else as well. Even though I'm recovering or healing or working with myself, I can still hold space and help people, whatever with the lived experience of my own thing, as well as a professional knowledge.
Yes.
So that is where my expertise or passion slowly I developed and moved towards this helping women to heal their emotional trauma.
Can you describe for us a typical day or OT session that you might have?
Typically, I actually engage with the online session of maximum 2 to 3 sessions per day. I won't schedule more than that because I highly respect my energy. Because since I have myself been in a journey of recovery, I also noticed and understood my brain functions and patterns and how much it can hold space for somebody else. I also recognize that I am not a neurotypical, so that I need to focus a lot on my energy management, etc., to navigate my work schedules. One of the reasons that I have to start this by myself is not only the passion, but there is a push. Because I don't have any options. Because when it comes to regular job, one point is there is unavailability of mental health related vacancies. Another point is, even if there is an availability, due to the intricacies of my functioning, like what I call it as neurodivergent in some level, in some degrees, which is not allowing me to be okay and be function well within a structure like regular job setup. So that's
Okay.
another reason why I have to begin this entrepreneur journey. So it's like a
Yeah.
push, no option, I have to do it. And I also love it, of course. On over the way, I also learned the through the journeys of up and down and its own flavors, etc. I prioritize my energy management, my efficiency, and according to that, I pace out the sessions. And in the sessions,
Mm-hmm.
I primarily focus on providing the guidance or therapy by asking them to do certain activities or giving some home programs as an activity and following up with them, which I like to term it as occupation centered psychotherapy, because I primarily ask about how it is affecting all of their areas like occupations. This is how my basic assessment or a kind of oral interview will happen with my client. So how this problem is affecting your sleep or food habits or your routine, your relationships. So then I will start taking one aspect and work with that, slowly getting into the next, depending upon their priority as well. Sometimes they themselves will say, first I need to start with, it is affecting my work area, I need to start from there. Somebody will say, it is affecting my relationship, I need to start from there. So
Mm-hmm.
for somebody, they will their basic areas will be affected very poorly, like sleep or eating habits. They need to start from there. So
Right.
I will explain them. So this is how my approach will be, and then with their own awareness, they will also tell me which they want to prioritize first to start
Do
with.
you use any standardized assessments in your sort of initial evaluation?
Okay, so as this is acute mental health care, I use a kind of the psychiatric assessment that my college had developed. We had a common assessment back then. My college had developed some common assessment in taking the history taking and the basic informations and
Mm-hmm.
uh, areas of their life is being affected, and how to do the short term goals, long term goals, and to plan, to do the treatment plan. The basic assessment, there is a standard basic assessment that is designed by my college when I was, so I continue with the same thing.
Yeah.
Apart from that, if there is a need, for example, if a client is telling me that they are getting disturbed by any kind of sensory nuances, then yeah, I will use the short sensory profile.
Got
Or
it.
their functioning capacity is really getting limited, then I have to use the fin scale. But I don't always rely on the standardized assessment. If it is a really real need to document, if they had such a intense problem that I had to use that, then I will continue to use that special assessments. So otherwise, the initial basic assessment is the one that I continue to follow with every other individual. Practical nuances in online, the assessment is itself will have a separate session. And here in India, people are just now coming out for support or seeking support, and they really don't have that good impression in spending a lot of time in assessment. So it is like creating an aversion for them at times. I have
Yeah.
tried previously in my beginning, but they really don't want to engage with a lot of question and answers, like in a very proper way of filling it up. And
Yes.
I just tend to go and flow with the session. So as I collect and receive information, based on that, I decide when I have to use the special assessments. And even while using the special assessment also, I will make sure the conversation is very natural, and through that, I will collect the information and then I will
Yeah.
fill it up, rather than asking them questions and mailing them to fill it up. So people are not interested in that level right now.
Yes. Well, it sounds quite trauma informed. You're going at their pace, right? And you're going
Mhm.
at, whatever you have observed to be the way that it works there.
Mhm.
So that's wonderful. Thank you for giving us all that information and, the details and the types
Mhm.
of, goals that you might work on with some folks and even, your kind of screening or evaluation process. I think all of those details are going to be super helpful to our listeners who might be inspired to do what you're doing over there in India.
One more thing, what I have noticed is within our profession, there is a high pressure to use assessments. So like we were thinking like just like only assessment, as if like occupational therapist work or our expertise is relied on assessment. Yeah, assessment
Yes.
is a tool which reinforces, which is helpful for us to understand our clients. It is not like
Yes.
it is not like only through assessment there is our work is there.
Yes.
Uh,
I,
yeah.
I completely agree because I don't always use assessments
Mm,
to get to know my
mm,
clients. In fact, I use assessments to learn more about them, but I
mm,
first get to know them like
mm,
you do in conversation or in dialogue.
mm.
I'm also seeing another benefit to assessments in terms of us providing OT services in these sort of non-traditional settings as a
Yeah,
way
yeah.
for us to collect data.
Documentation.
Yes,
Yeah, data.
to collect
Mm.
data and really prove that, what you and I are talking about, it works, that
Yeah.
it is effective, right? So that's another giant value that is also important to mention.
Yeah, yeah, of course. There is a huge importance lies in documentation, and I really give priority towards that.
So, how do you receive your referrals? How do you get your patient? How are you able to promote yourself?
So in this digital era, yeah, as all we all know that our primary means of promoting our work, our message, our voice is everything through social media. So when I actually start off with my work, that is the time period, the social media promotion and everything is very booming that I had no way that I had to do that. Even though I'm a person, I'm not so convenient with the digital or technicalities. I had to learn and practice, and I have to become comfortable with that. That is a huge part of the story, different story. To become comfortable or building a positive relationship with social media is a thing still to learn. It's on the way. Yeah, yeah. So that's laying as a primary means of connecting or reaching people. Apart from that, there is a there's a referrals that comes from. Known people mostly maybe through word of mouth, the services that my previous clients got, and they will just spread the message in a very organic way. That also happens at
Mhm.
times. um, yeah, so but primarily it relies on this social media right now.
Okay, thank you for sharing that. Um, Now let's get into some money matters because that's always an important question. How are you able to bill for your services? And yeah, how do you get paid for what you do?
Okay, I'm reaffirming myself that I love money. It's okay to get money from my clients because that's a kind of um I don't know whether this kind of belief pattern or conditioning exists in other countries, but in India, we are being so conditioned when it comes to healthcare services or mental health care services. We were conditioned like it should be very cost efficient. It should be very, we should provide free, we should not charge more. All such notions of beliefs has been ingrained since our college itself. who will come, because people are not coming forward itself. We need to create a lot of awareness and we need to advocate for it, mental health, everything.
Mm-hmm.
So even if they come forward, what if the charge is quite, for us, it is a decent pay. Maybe like $1,000 per session is a decent pay. Actually, at least the well-deserving and decent pay for a session should be that. But it is not easy to just uh, confidently declare. There's so much mixed emotions. Oh, what if my clients think that I'm charging more? What if they don't come forward to take my next session? So all this what if has been in the initial stage of my entrepreneurial journey, and I'm slowly navigating and turning it into a new belief system. I'm reconditioning myself to respect my work, to give the value that I wanted to give. So yeah, currently now I have a standardized um, charge for my services. Um, but as a person, it is taking a lot of time to be okay with the charges that I have set myself. Like, okay, like being okay, because sometimes, the people will induce the guilt. Oh my God, why are you charging this much? Or you should charge very less, then you should be a kind of service provider. Here, the service means it should be very less. That is how the entire, not only for occupational therapist, even psychologist, even any other fellow speech therapist, even for physiotherapists, the same scenario.
Mm-hmm.
Uh,
Yes,
this is quite
it's
complex here, and we are navigating through that. So currently, I have got some client base, and I have navigated that the initial journey, which is quite tough, and I learned and reframed my own belief system, and now I'm okay to say, yeah, I charge this, and if you're unable to provide, we also announce, in special occasions like maybe mental health awareness month or some event full days, we also announce some kind of offer, like providing some packages in a discounted cost. We also provide that.
got it. Okay.
Mm.
Just to confirm, you have a standard rate for your sessions, right? Your sessions are generally about 45 minutes to 1 hour long, that kind
Yeah.
of thing, and that you're able to charge, like it's a cash-based service. It's not
Insurance.
you don't do
Here there is no
insurance or go
insurance.
through a
Yeah.
third party. Okay. Now, is that a route that you can take if you chose to sort of use insurance? Is there insurance?
Actually, in India, the insurance doesn't cover mental health, unfortunately. My parents had health insurance. It doesn't have a mental health. Even
Got it.
I'm having health insurance. It doesn't cover mental health. So that I think now very few companies are coming up with an idea to also include mental health. But it will take time for people to take their service, right? Take their plans. So it's not
Yes.
reaching to the to the mass population.
So hopefully those things will change soon as folks learn that it's okay to receive this
Mm.
assistance, that in fact your mental health is just as important as your physical health,
Yeah.
right? But I get it. Why would they pay for it if no one needs it, right? So folks
Mm.
need to talk
Yeah.
about how much that service is needed. So it's
Mm.
very similar here in the United States in the sense where not as valued or reimbursement
Mm.
rates are not as
Mm.
high. So hopefully things will change and, with greater awareness and you certainly pioneering, giving other OTs the opportunity to kind of hear how you may have done it.
On a positive aspect, I would also say, because now the younger generation is becoming aware, with proper marketing or with proper consistent way of showing up with our services will really, or create the stability and scope financially as well. I won't say I'm not seeing growth. I'm seeing growth. It's sustaining. It will take time to turn into profit. What I mean as an entrepreneur.
So, on that note, do you have any career advice for any of our listeners on how to get started on this path?
So first thing, so I just want to tell it in a very common aspect, apart from any OT students, even if they are not interested in mental health, just listen to what you're naturally interested. What are your natural skills? What you're naturally drawn towards to help individuals? And do listen to that inner voice within you, which is telling you, this is the nice thing, this is the thing that naturally feasible for you. And maybe along the time, you can also do some courses related to that, maybe any certifications, any learnings, or at least working in a setup closer to that field, what you are interested, um, getting an experience in that field, even as a volunteer when you're a student. See, if you're
Mm-hmm.
a student, you're having a passion towards something which is out of that box, you can observe what is happening as a volunteer. See, in my days, I have been a volunteer in an NGO. I have observed the nuances of the activist and social justice things, and I have been in field work. So that got me an idea of now that is helping me to see in a very holistic lens of how I can connect back to OT, etc. Maybe in the near future. So likewise, you can also it is not necessary to invest money to learn a course all of a sudden immediately, but at least you can start with volunteering options or any kind of observing the field through any other options. And when you're having the capacity to invest and learn some course related to your passion, when you get a clear cut clarity, then you can invest and learn and trust the process. Maybe even if you're working in a regular setup, the setup which you are not so passionate about, just for the sake of building experience or for your living, you can simultaneously do a part time or provide some services which is of your own passion. Because now
Mm-hmm.
providing services is online is a boon. Like it is a good thing for us. There are many things is coming. Many professionals are coming out as a healthcare coaches and coaches. It is there. So many of the Indian OT students are not aware about it. Especially OT students are not having that expansion of awareness about it. They are thinking, okay, after we are going out, we have to work in a clinic or in a hospital, even though if we don't like. So
Yes. Such great advice. Thank you for that. Now, can you share with us any common myths or misconceptions about your current role that you would like to demystify?
So I like to demystify that um, occupational therapists are not only for, of course, it's not only for pediatric rehabilitation or or the physical rehabilitation, that multiple disability rehabilitation. So even if it is adults, people think, oh, then it is like a multiple disability rehabilitation, right? So this will be a response. So we have a lot of roles, and our primary role is to enable individuals to um trust in their own healing process in whatever they are being challenged with, through our focus on building their routine and helping them with their ADL, helping them with their occupations. So that is our primary thing. It's not about this department or that department. So
Yes.
we can work in any department with our core skill as occupation centered practitioners.
Thank you for that and for everything that you've shared with us today about your journey. If any of our listeners were interested in staying in touch, connecting with you to ask you any questions about your path, would it be okay for them to reach out to you? And how do they do so?
Absolutely. You can reach out to me through LinkedIn. So I will be responding to the messages when it comes to professional collaboration. LinkedIn is a platform that I will be active. When it comes to Instagram, I mostly focus on providing education and awareness for the audience, like for the public.
Okay, great. We will list all of those resources on your show notes and make sure that everyone has access to that so they can get in touch with you if they have any questions. So thank you so much again for spending the time with us today, for sharing with us your journey into your own private practice of providing holistic mental health support there in India. I congratulate you on what you've accomplished so far and wish you much success.
Thank you so much, and thank you, Patricia, for being a bridge across nations, across different OTs from different nations, and you are really bringing their light outside. It's really a dedicated work, and it's also a tedious work, but you're doing it out of your own love and dedication towards OT. I really inspired you and your work a lot, and thank you for this wonderful opportunity and this possibility. Yeah, I think we both believe in the possibility of the new non-traditional ways of practice. Yeah, kudos to that. Thank you so much.
And that wraps up another inspiring episode of the Uncommon OT series. Connect with me at www.transitionsot.com. And don't forget to sign up to be part of the Transitions OT community. By doing so, you'll receive my latest compiled list of uncommon OT practice settings, the latest news on mentoring offerings, uncommon OT live events, non-traditional OT resources, and more. You may also follow me on my social media pages on Instagram and LinkedIn. And if you love this episode, head on over to Spotify, Stitcher, Apple, and Google Podcasts to follow, rate, and leave a review. I also ask you to consider pledging your support to my Passion Podcast project by being a patron on Patreon. It is very much appreciated. Sending big OT love. Thank you so much for listening. Until next time.